Next, moving from MRI to angiography, we'll hear about advances in X-ray. Dr. Adnan Siddiqui is the Vice Chairman and Professor of Neurosurgery at the State University of New York at Buffalo. Dr. Siddiqui completed fellowship training at the Thomas Jefferson University in Philadelphia and his neurosurgical residency at Upstate Medical University. He received his Ph.D. in neuroscience from the University of Rochester and medical degree from the Aga Khan University in Pakistan. He's received acknowledgement as Fellow of the American Association of the Neurological Society, Fellow of the American College of Surgeons, and Fellow of the American Heart Association. Dr. Siddiqui serves as Director of the University at Buffalo Endovascular Neurosurgery Fellowship Program and as Director of the Neurovascular Research, the Collider Health Stroke Service, and the University at Buffalo Toshiba Stroke and Vascular Research Center. He is a member of the Gates Vascular Institute and serves as the Chief Medical Officer for the Jacobs Institute. His interests include microsurgical, radiosurgical, and endovascular techniques for the comprehensive management of cerebrovascular conditions, acute stroke management with intra-arterial thrombolysis, and endovascular and microsurgical management of extra and intracranial vascular occlusive disease. He is extremely well published and is a highly sought lecturer. Tonight, Dr. Siddiqui will share his vision for the future of angiography and how high-resolution imaging plays a vital role. Please welcome Dr. Adnan Siddiqui.
Thank you. Well, thank you very much for this invitation and the opportunity. It's an actual delight to be able to present this work on what is now called high-definition angiography. It's an honor for me to be talking about it while the inventor is somewhere there in the audience. Professor Steve Rudin of University of Buffalo really started this work some years ago, I think 15. And so it's my absolute pleasure to be able to use a commercial version of that vision and report to you some of the initial cases that we've done over the last few weeks. So the current challenge, thank you very much, Sheldon, for that incredibly protracted introduction. I'm a neurosurgeon, and so as a neurosurgeon who treats vascular disease, I treat it both through open and endovascular strategies. And so visualization, endovascular visualization, interventional visualization is paramount to performance of the procedure. And so we have problems because we've got to look through the skull, and we have great difficulty visualizing devices. In fact, we have to have very specific markers on all devices to be able to see the ends of the device. Forget seeing what the device itself looks like. And so the hope here was to have high-resolution imaging that could really improve visualization, optimize device deployment, because most devices in the brain are these fire and forget. You put it and then you can't do anything about it because it's already there. And then hopefully have that translate into safer patient care for neurointerventional procedures. So the work that I'm presenting today is on this new high-definition detector. It's now called high-def or HD. And the cool part about this is that there's an automatic transition between normal flat panel detector to the HD version. So there's no particular turning on or turning off of systems. It's a seamless approach, and you simply say, you simply push the buttons to go from a 12-inch, 10, 8, 6-inch, all the way down to 1.5-inch zooms. So I'll share with you just a few cases. We've had this machine now for about 3 weeks, and so I've done a few cases of all different types, but I thought I'd like to show you just a couple of snippets to show the value of this technology. So this first case was my first case. And it's a 70-year-old woman. She had multiple brain aneurysms. I had clipped through an open craniotomy her right middle cerebral artery aneurysm. I had used a flow diverter, which is a high mesh density stent, for another aneurysm. And then this third and last aneurysm was planned for treatment for using stent-assisted coil embolization. So we got our devices and tools up there. You can see the listing of the guide catheters and sheets, etc. And I'll tell you about the devices as we go along. So what you can see in this video is this is your standard flat panel detector. It's actually very good. It's at 6-inch. You can see the cranial plate from the craniotomy. You can see the two additional clips that are positioned for the MCA aneurysm. And you can see the stent is being deployed right here. Now, traditionally, all you can see are these markers and barely see anything else. There's a microcatheter behind in the aneurysm, which is located right here. Now, with the HD, you can actually see in great detail every single tine of this device. And by the way, I have to tell you, this video is nowhere as close to what the real image looks like, because the videos have been compressed and recompressed to be able to show them on a PowerPoint slide. But what you can clearly see are not just the markers, which are normally visualized, but the entire device. And you can see exactly how well this is open, whereas it's really hard to see that kind of detail on a normal definition. So here's an example now of the same aneurysm. It's being coiled. Again, the image quality on this screen is not reflective of the true image quality, but what I can appreciate here is the microcatheter tip. I can see the coil. I can see the coil ending zone. I can see the detachment zone. I can even see wrinkles in the primary coil wind as it's going up, well before I actually see the detachment zone show up to this proximal marker. And that's the beauty of the system, is the kind of detail I can see that obviates the need for a lot of fancy tricks that we employ during neurointervention, such as road mapping or fake road mapping, etc. So I think it really makes a tremendous difference. And there's additional coils that are being deployed. Now I can see my microcatheter is almost slipped out. I know where this coil is going. It's going into the anterior communicating artery. And so I can very clearly see that and appreciate that much better on this platform than on the standard image. And this is the final angiogram, which shows excellent wall apposition of the stent, excellent coil embolization and patency of all vessels. So this was a highly successful case, by the way. Two things to note. One is that obviously these images are compressed, but second, this is an awake procedure. So the patient is under conscious sedation. So this is not a paralyzed, sedated, intubated patient. So these are normal motions that are occurring during the performance of the procedure, but the high resolution ability of being able to see exactly what you're doing obviates the need for general anesthesia, I believe. So this, the next case, is the flow diverter. This is something really popular with neurointerventionalists nowadays. It's a high mesh density device, and there's a PCOM aneurysm in this woman who I previously treated for an acoustic, and now my plan was to put a flow diverter now that her craniotomy is done. And so there is the carotid injection. You can see this large PCOM aneurysm pooching down. This is under high definition 3-inch. This is at standard 10-inch. And you can see that there's no loss of signal at these two images. So when you go to deploying the device, this is your standard flat panel detector. Where's the stent? Literally, this is what we have to work with because you're looking through the skull. This is the device being deployed. And again, it's not as pretty as it is in real life, but I can even see the wrinkles in this high mesh density stent being deployed, whereas it is very, very hard, and you have to really squint and turn your head sideways to be able to see what the device looks like under standard flat panel detection. So I think it makes a tremendous difference. And look at how I can see the edge of the stent compress as I use my microcatheter to really position this ideally. Now, in my mind's eye, I knew I was doing this before, but now I can actually see it happening in real life. And so this is after deployment under high definition. You can see great wall apposition of the device. There's a little bit of delay in flow, which is exactly what you expect to see. And this is under standard flat panel detection, where you can really not appreciate the stent at all. And finally, the last couple of minutes, something which doesn't involve the skull. It's a carotid stent. This is a patient with symptomatic carotid stenosis presented with a TIA, and we elected to place stent on him. And this is the detail you see, the stent. And it was just spectacular. This is a wall stent. You can see every single wire in that device. You can see the balloon going up and down, and it is just incredible as to the resolution you get. There's my guide catheter, and you can see that very, very well as well. And when we go to our next slide, you can actually see the capture device. This is the distal embolic protection device. I can see the individual markers. I can see the wire. I can very clearly see how nicely I've captured it, but not squeezed any debris out of the basket and then pulling it back in. And that's your standard flat panel detection. Although it's good, this is just unbelievable. Our feeling is that and this is again standard flat panel detection at the end of the case. This is very early. We just got it 3 weeks ago. I'm looking forward to next week doing some more cases and really understanding how to use it. I think it's been spectacular. We measure our dosage with every single case using the dose tracking system, also made by Toshiba, which really allows us to measure explicitly what we're using, and we've been very satisfied. In fact, it compares remarkably well with our standard use of flat panel detection, and so we're going to conduct some of the studies. So I think it's spectacular in terms of the improved visualization of these neurointerventional devices, where now we can start moving beyond just looking at the markers at the end of the devices and looking at the entire device and being able to manipulate that during deployment. I just can't stop imagining all the different things we can do in terms of making new devices now that we can actually see them. Thank you very much.